Hi guys, my name is Anna Hightower and this is my compare and contrast presentation. So the first slide is telling you a little bit about the journal. A few of the authors, there are four authors in total. Their names are Katrina Armstrong, Karima Ravenel, Suzanne McMurphy, and Mary Pratt. And a little bit about them is so at the time of the study, Katrina Armstrong, Karima, and Suzanne were with the Department of Medicine and Leonard Davis Institute of Health Economics, University of Pennsylvania, Philadelphia. And Mary Putt and Katrina were with the Department of Biostatistics and Epidemiology, University of Pennsylvania, Philadelphia. So the title of the article was racial / ethnic differences in physician distrust in the United States. It was published in 2007 and it was also peer reviewed by the American Journal of Public Health. So a little bit about the introduction. So for many years, trust has been a key factor in relationships between physicians and patients, especially fidelity-based trust. And this relates to the idea that physicians will actually have that care factor and actually care for the patient's interests and well-being. Um, and this, like I said, does include fidelity and honesty, being honest with the patient. In the article, Armstrong stated that theoretically, trust is central to a physician-patient relationship because of the risk and uncertainty inherent in medical care. So a lot of people going into these medical facilities, they already have the thought in mind, like, okay, well, most people tend to do, take advantage of the insurance and, run unnecessary tests. So this is basically what Armstrong was stating. And then the purpose of this study was to uncover the racial differences in one component of physician trust across different metro areas. Um, I really can't see that right there, so I'm just gonna take my video off for a second because it's blocking the block. Mm-hmm. So moving forward, so as far as the methods that they used, so there were in total of 15,576 participants, and they range from Black, Hispanic, or white. It was a restricted sample to the 20 communities where at least 5% of the sample was Black and 5% of the sample was Hispanic. So they picked communities in which there was a total of the two. So at least 5% of the community had to be Hispanic and 5% of the community had to be Black. For the data that they they analyzed data from the 1998 to 1999 community tracking study, which is basically a population-based survey of health and healthcare conducted by the Center of Health System Change. In my opinion, it was a qualitative and quantitative study. Participants were given a survey to complete that asked a total of 4 questions concerning physician trust. And I have the questions written down right here, so I'm going to read them to you guys. So the questions were, I think my doctor may not refer me to a specialist when needed. I trust my doctor to put my medical needs above all other considerations when treating my medical problems. I think my doctor is strongly influenced by health insurance company rules when making a decision about my medical care. And lastly, I sometimes think that my doctor might perform unnecessary tests or procedures. Those are the questions that they use in this study to collect their data. Okay. So for the results, um, so Blacks and Hispanics reported higher levels of physician distrust than whites in the univariate analyses. And then overall, lower socioeconomic status, which is defined as lower income and lower education, and having no health insurance, was all associated with higher levels of distrust, with men generally reporting more distress than women. The results show examples of cities in which Blacks reported consistently higher levels of distress than whites, and consistently mixed lower levels of distress on whites, or as well a mixed relationship, all dependence on socioeconomic status. So basically, what this is saying is it was varying. So depending on the community, they saw it was like a go up and down kind of thing. that they've seen, so depending upon the social and economical status and many other factors. And then Armstrong stated in the article that racial ethnic differences in physician distress are less uniform than they had previously hypothesized, with substantial geographic and individual variation present. So basically, she was trying to explain that their hypotheses was a little bit, standardized compared to all the other outside factors that had a role in the distress factor. So over discussion and limitations, discussions. So the study showed a variability in distress in physicians amongst Hispanics, blacks, and whites in the U.S., varying between where they live and their social demographic characteristics. This includes their gender, educational attainment, and insurance status. So like I said on the previous slide, these things greatly impacted distress between the physician and the patient. The study uncovered that the pattern of distress is much more complex. So for the limitations, there were several that were stated in the actual article, but these are a few that I pulled. So considering the fact that the trust items were developed by the Center for Studying Health System Change, this provided a relatively narrow measure of physician distress. So this is basically saying that since their sample size was only for a specific population, which was going back to the only 5% Black and at least 5% Hispanic as well. So it kind of narrowed down their sample size, which basically gave them a relatively narrow measure of physician distress. So it couldn't be, compared to the big population, it wasn't as strong. So because they only wanted to compare patterns amongst Black and Hispanics, their sample only had a small number of sites. Therefore, this didn't provide enough, information to argue their entire hypothesis. So this limited their ability to see comparisons involving geographic variations and racial differences. So communicating results. So from the external media source, so in the Time magazine, the author discussed mainly the Tuskegee syphilis experiment and the exploitation of Henrietta Lacks. And these two are a little more known than a lot of the other things. And this is going into what I would have wanted to stress in these articles. So a few things that I would want to stress is the potential reasoning for distrust in physicians, as well as more information that involve more known cases of unethical experimentation. So I know that these two are very big in the history, but I would also want to stress on more of those in the history, as well as the last thing I would want to stress is current instances of unethical experimentation. So yes, the things that happened, decades back are extremely important and crucial, but what about the things that are happening right now? So I would have wanted to stress those things.